Why is it that if the Bronx is a borough of 1.4 million people, where over 40% of the folks who live here were born in another country? Why is it if we're the borough with some of the most world-renowned healthcare institutions? And why is it that if the healthcare industry is the biggest employer in the Bronx, why we continue to be the sickest county? I mean, is it the air? Is it the water that we drink? Well, once again, we're frustrated for the last several years in being the unhealthiest county of the 62 counties in the state of New York. And so we're sick and tired of being number one in everything that's bad as it pertains to health. This is not the place where we want to be. So something needs to change.
So there are many things that impact health, things like poverty, income inequality, housing segregation, and education all work together to either help create healthier environments or have a negative impact on our health.
I run and direct the Bronx Health Reach Initiative, which is addressing racial and ethnic health disparities here in the Bronx. We have been implementing a number of activities and programs to really improve the health of Bronx residents. This is promising. We're addressing things such as having more bike lanes in the Bronx. We're addressing going out into the community and doing health promotion. We're addressing food access. We're working with supermarkets and bodegas and greengrocers to increase food access to the people in the Bronx. And we're doing health education and health promotion so that folks know that they have these improved access to so many of the fruits and vegetables that they had not had in the past.
So right now we're here in the Garden of Happiness, and I say that because when you come into this garden, it makes you feel happy. It's one of over 100 community gardens. And in here we try to grow food that is healthy. One thing that I'm proud about is the fact that we try to educate not only our elders but our children. Also we have chickens, and chickens are part of the community garden and a part of the environmental process, so kids understand the relationship between food, plants, animals, and people. We form the La Familia Verde Farmers Market, which is on Tremont Avenue between La Fontaine and Arthur Avenue, every Tuesday from the month of July until November. Anybody comes to our market who is hungry, we give them a bag and they can take as much as they can. No one should walk away being hungry. Food is a right for all and not a privilege for some.
The great thing about the Robertswood Johnson Foundation is their rankings have a lot of detail. And what that tells us is where are the places that we need to start. Now, as an elected official and as a resident of the Bronx, I want to work along with our community members and other leaders in the city and here in the Bronx to make sure that we can have an impact on those things. If we're talking about access, again, access to fresh fruits and vegetables or just better food choices, places where people can exercise for low cost or free, making sure that our parks are tip-top shape so that people can actually go and work out in them. These are the things that once we have that information and these rankings give us that information, then we know where to start from.
So Urban Health Plan is a network of community health centers in the Bronx and Queens. We provide primary care. We also provide a lot of services that help support the patients. So we had the opportunity of partnering with the New York City Department of Health and Mental Hygiene on their Shop Healthy initiative, which allows us as partners to go into the community, identify bodegas, identify grocery stores, identify supermarkets where we could actually promote healthy foods. Request that healthy foods be available to you. So where you purchase your foods, where you buy ready-made meals, ask for healthy foods, ask for water, ask for fruits, ask for whole grain bread. Those are the kind of things that will make the owners of those venues know that you're interested and that there's a demand for them. I encourage everybody who's interested in either adopting a bodega, grocery store, supermarket, or learning more about this initiative to call 311.
Healthy choices around food are important, and so is regular exercise. At the Mary Mitchell Center, we have fitness and sports in our after-school program, and we have dance, martial arts, and basketball clubs. We have a food buying club called La Canasta, so that families have access to fresh food. We have a simple strategy of taking the stairs. Taking the stairs is a way to burn calories and to be heart healthy. Organizations of any size and community residents can get stairwell prompts by calling 311s. There's no fee, and you get them in about a week. The Bronx DPHO has helped the Mary Mitchell Center and really everyone in the Bronx through the research that they do on health issues. It was the Bronx DPHO that worked with our teenagers to understand the problem of diabetes and obesity, and because we understood the problem, we could start working on the solution.
Here at Montefiore, we've actually taken several positions that relate to what's available here at the hospital. We want people to be healthy when they're here, but not only our patients. We also want their friends, their family, and any visitor that comes through. So the first thing that we did was we actually banned trans fats from the hospital. We wanted to make sure that we weren't creating patients, so instead we actually removed it and switched to a more heart-healthy oil. Corporately, we've actually made big changes. Every last one of the vending machines at Montefiore only sells healthy snacks. We actually took time to explain to people that it was important that their foods have enough fiber, not too much sugar, and that things could actually taste good. We also switched our beverages out, and now we only sell non-sugar sweetened beverages here at Montefiore. And water is available at every single one of our vending machines and at a reduced cost. By dialing 311 from any phone in New York City, we'll actually be able to connect with information on how to adopt the standards for you.
We want the Bronx not to be at the bottom of the heap, but to be one of the healthiest counties in the city. And we feel that if we can do this together, and if we can get people together and organizations and leadership together, that's exactly what we need to make a difference. And that's what the Bronx campaign is about.
There is a movement underfoot where we will eventually see the Bronx no longer rank the lowest, but really climbing upwards. There is hope.
Smallest thing that we can do to change our personal habits is the first step to be able to be healthier as a community. Working along with other elected officials here in the Bronx, that we can do the small changes to have an impact on these numbers. These numbers will move, and together we're going to be able to move them.
So one thing I want people to take away is that the Bronx is no longer burning. The Bronx is resurging. The people in the community are now galvanizing and coming together to turn the narrative about the way the Bronx is looked at. There is hope.
The Mary Mitchell Center is working on a health initiative where we share our resources, and we are putting forward a healthy platform for the Bronx. We have to work together in lots of different ways because everybody deserves to be healthy.
Regardless of what organizations do, big or small, the greatest resource is the people that exist in this community. The Bronx, in my opinion, and in many others, has the best population in the world. And together, we will be able to go forward and to make a difference and make a change.
We're starting with the individual. We're starting within the family. We're starting at home. But we also have to change the attitude and the mentality, the thought process of Bronxites. So my vision health-wise is to have a healthy citizenry. Why? Because I want my fellow Bronxites to benefit from all of the great things that we've been working on. I mean, we're the borough of resiliency. We're the borough who has risen back from the ashes of the 70s and the 80s. So I believe and I remain optimistic about all of the work that we've done. I'm optimistic about all of the partnerships that we've had over the last couple of years, because we don't have to be in last place. I believe that we can be #1 in health.